You'd probably expect to see on an episode of Fox's House, a blood disease many people don't even know about. But in reality, it has the potential to infect 1 in 10 people of European heritage. Dr. Joe tells us what it is and how you can find out if you carry it.
Well, Frank, it's called hemochromatosis. It's a gene carried by up to 1 in 10 people, highest in those who have British and Irish in their blood. If you carry the gene, there is no problem. But if both your parents have it, the effects can be devastating.
They might seem like competitors at the card table, but Christine Hogan and her brother Darren O'Donnell are both dealing with a hand of genetic cards affecting their health.
I'd get up to the top of the steps on the 3rd floor and actually black out, go to tunnel vision.
At first, Darren's heart raced. Christine had no energy.
All my enjoyment was on the couch.
Hair loss, joint aches, and darkening skin color came next. Blood tests showed her liver was out of whack. Doctors thought it was alcohol and drugs.
It's like, listen, I don't drink. I've never done an illegal drug in my life.
Darren's doctor missed it too.
I ended up getting sick, and she kept insisting that it was a pneumonia.
But it wasn't. Specialists made a diagnosis they never expected. Both have hereditary hemochromatosis. It's a genetic problem causing iron to build up in the body.
If it's uncontrolled, it's extremely dangerous.
Dr. Jerome Sullivan has been studying the effects of iron for over 20 years. We all need some iron. It helps our blood carry oxygen. But in this disease, too much iron ends up in the organs and muscle, and that's toxic.
It can be fatal because of diabetes, liver disease, cardiovascular disease.
Caught early, treatment can be as simple as regular blood donation. It keeps iron levels in check. Diagnose it late, the damage can't be reversed.
My doctor told me I had like 20 or so heart attacks from all the scar tissue that's on my heart.
Darren's now 28. He's disabled, and he has a defibrillator in his chest. Christine's liver is failing.
I have a 200% chance now of developing liver cancer.
They want others to learn from them and ask their doctors about a simple blood test to check iron levels.
It's a lousy little $60 test, and it will solve a world of problems if you find out early.
Here's why that's important. Iron tests are usually not part of routine lab studies, and hemochromatosis isn't the only disorder that causes too much iron. Iron can affect the brain and immune system, and get this, women's symptoms often show up later than men's because they regularly lose blood in their periods. And like many young mothers, Christine says when she began feeling weak, she doubled up on iron pills, thinking that would give her energy. That, of course, only made things worse. Just shows you why talking to your doctor about this is so important. Denise, Frank?